A 12-lid ECG has 6 limb lids and 6 chest lids. These 12 lids are the 12 different cameras watching your heart from 12 different angles. The ECG machine has 10 electrodes, 4 limb electrodes and 6 chest electrodes. The 4 limb electrodes are attached to all 4 limbs. Out of these 4 electrodes, the electrodes of right hand, left hand, and left leg form the triangle. It is called Einthoven's triangle, named after the inventor of electrocardiogram, Dr. William Einthoven. He was a Dutch medical doctor and physiologist. He invented the first practical electrocardiograph in 1895 and received the Nobel Prize in Physiology or Medicine in 1924. Both hands' electrodes combine and gives us our first lid, the lid 1, watching the heart from this direction. Electrodes of the left hand and left foot combine and give us our second lid, the lid 2, watching the heart from this direction. The electrodes of the right hand and left leg combine and give us the third lid, lid 3, watching the heart from this direction. You guys must be thinking about the electrode of the right leg. Why it is not deemed useful? It is because the electrode of the right leg is neutral. It is only used to complete the electrical channel. The other 3 electrodes form the 6 limb lids, while the electrode of right leg is totally unearthed. Now we have 3 lids, lid 1, lid 2, and lid 3. Lid of ER is formed by the electrode of right hand, watching the heart from this direction. Lid of EL is formed by the electrode of left hand, watching the heart from this direction. And lid of EF is formed by the electrode of the left leg, watching the heart from this direction. So now we have 6 limb lids produced by the 4 limb electrodes. And we will need 6 chest electrodes to produce 6 chest lids. The chest lids are applied on the front aspect of the chest in this manner. These lids are called V1, V2, V3, V4, V5, and V6. These 6 lids kid the 6 different angles of heart from the front aspect or anterior aspect of the body from these 6 directions. So now we have all 12 lids, 6 limb lids formed by the 4 limb electrodes, and 6 chest lids formed by the 6 chest electrodes. Let's understand this with a few examples of ECG. Let's start with the first ECG example. This is the ECG of anterior wall ST elevation myocardial infarction. In this ECG, there is a ST elevation in lid V2, V3, V4, V5, and V6. Let's see which lids are facing anterior part of the heart. Obviously, it's all chest lids, especially V2, V3, V4, V5, and V6. The second ECG example is inferior wall ST elevation myocardial infarction. In this ECG, there is an ST elevation in lid 2, 3, and AVF. Let's check this out on the lid placement. Which lids are covering the inferior side of the heart? As we can see, it's lid 2, 3, and AVF. Our third ECG example is lateral wall ST elevation myocardial infarction. In this ECG, there is an ST elevation in lid 1, AVL, V5, and V6. Let's see which lids are covering the lateral side of the heart. Because the heart is little tilted towards the left, the limbs lids in the lateral segment are lid 1 and lid AVL. And the chest lids that are covering the lateral side of the heart is the lid V5 and lid V6. The next ECG example is the posterior wall ST elevation myocardial infarction. In this ECG, there is an ST depression rather than ST elevation in the lid V2, V3, V4, and V5. Let's see which lids are covering the posterior side of the heart. There is actually no lid covering the posterior part of the heart because we cannot put lids on the back of the patient. So the lids are against the posterior part of the heart are the chest lids, which are lid V2, V3, V4, and V5. And that is why there is ST depression on 12-lead ECG rather than ST elevation. So these were the few ECG examples for the 12-lead ECG. And there are certain other ECG rhythms which are essential to learn for this profession. You guys can check out those videos on our channel if you like. And thank you for watching this video. Please do subscribe.